about a year ago, we all sort of found each other through Primary Care Progress, through conversations that we started to have and pull in other people because we all knew somebody else who was also working kind of alone. So connecting the dots, that's what Primary Care Progress has done at UCSF. We're in different specialties. We don't necessarily know that we're interested in sort of the same theme, and uniting our efforts is really exciting.
You feel alone, but you're not alone. It might be a small group of people, but this is an issue that pervades through our whole healthcare system. And so there is interest around it, but it's hard to overcome the activation energy of, well, I don't know what to do.
One of the biggest challenges in primary care is the siloization that occurs. And by bringing together people across the primary care spectrum, from family medicine, internal medicine, and pediatrics, to learn together and to exchange and collaborate, that's one of the best opportunities for them to work together to solve some of the problems facing primary care.
You know, one very clear benefit is that you're teaming up with other people who have a similar interest. And you know, together you can do more than you ever could apart.
And it's also really nice to have a group of people who are thinking about the same problems and offering solutions to problems that have come up in clinical practice that people have been struggling with for decades. To have a network for dissemination of information and new ideas is crucial.
I feel like it lays the foundation, the bedrock per se, of our interest or of our learning and exposure to what primary care is all about.
It's really nice to feel like you have some agency in this massive, hulking, clearly flawed, kind of crazed, over-moneyed system. It's really cool to think, hey, I can actually do something and see some results.
Medical trainees, students and residents, they have a lot of power. Because within these local academic institutions, who do deans listen to? They listen to the trainees. So when these trainees have realized what power they hold and come together and bring their voices to bear on an issue that they want to change, we have seen time and time again that changes happen.
It connects people who are involved in a similar goal. It helped get our clinic off the ground.
I think it's been it's made me very hopeful. I think it's made me very hopeful about the future of primary care.
If I can do this, do what I'm doing and what we're doing in our area, it's that accessible to other people in their areas.
Okay, and I think, honestly, I think it's made primary care sexy for all of us.
Primary Care Progress to me is like my own primary care medical home. It's like where I can go and find the people I need, the resources I need, the community and fellowship I need, the inspiration I need to fill my cup, to go forward. It's kind of all there, and it's because of the people, the support, the vision, the organization that doesn't exist anywhere else that I've found, and I have been looking.
Right.
So Primary Care Progress to me is that home, and it's really nice to be home.